they're common, often silent, but sometimes life-disrupting. We're talking about fibroids, the non-cancerous growths in the uterus that affects millions of women. But how serious are they?
Joining us today to discuss more about fibroids is OBGYN Dr. Hack. Dr. Hack, thanks for joining us.
So what exactly are fibroids and how common are they?
Sure. So fibroids are typically benign, smooth muscle growths. There are these benign growths that are very common. In fact, they're the most common growths that women have in their pelvis. And they are so common that women, by the time they reach the age of 50, are likely to have them. About 80% of black women will have them by the time they turn 50, and then about 70% of white women will have them by the time they turn 50. But we do know that certain things like female hormones, progesterone and estrogen do cause an increase in growth in fibroids.
Now, can fibroids be cancerous or increase the risk of cancer?
No, thank goodness. So fibroids, the leiomyoma, also known as myoma, are very, very, very unlikely to be cancer. There are fibroids that can be cancerous. They're called leiomyosarcoma, but those are very uncommon. So what most women experience are benign fibroids. So there are a number of things that impact fertility, but fibroids are often found to be a cause once they've ruled everything else out. And a lot of that depends on where in the uterus the fibroid is located. So if it's outside of the uterus, not so much. But if the fibroid is inside the uterus, we think of the uterus kind of looks like this. If it's growing somewhere in here in the same place that the baby would be growing, then they can affect fertility. Yes.
A woman with fibroids who is pregnant, how does it impact them?
Sure, that's an awesome question. So if the fibroids during pregnancy grow, which they often do because they have lots of access to progesterone and estrogen, then one of the more common things that people can experience is what we call malpresentation, meaning the baby doesn't have its head down in the pelvis like it should for a delivery. It often has its head up. That happened to me because I had a large fibroid. But other things that women can experience are preterm labor and preterm cramping. Those are some of the more common things. If somebody has fibroids, maybe they're small, but they're causing a lot of problems and they don't want to get them removed, then we might try medications to kind of control the bleeding and keep the bleeding lower. But sometimes the fibroids need to be removed, and there are invasive and less invasive procedures. So something invasive would be like what's called a myomectomy, which is